PCOS, which is the leading cause of female infertility, 25%.
Explain what that is.
Yes. So very good question. So PCOS is the leading cause of female infertility. Anyone listening of childbearing age will know about this. It's an epidemic right now. It's gone up. It's multiples in the past generation.
What does it stand for?
Polycystic ovarian syndrome.
So
cysts.
Well, let's get into it. So that question you just asked, I know OBGYNs from Harvard who could not answer that question. This is not an exaggeration. OBGYNs are not taught what the condition is. They're only taught what the intervention is.
Okay, so let's always start. I know nothing about medicine or science, but I do know about interviews. Always start with the dumb questions first.
Good.
If you can't answer the dumb questions, I don't believe you.
So when a woman, and many women listening will have PCOS and across their OBGYN, they're put on a cascading set of interventions that are pharmaceutical.
Can you tell me what it is?
Yeah, it's insulin resistance. It is not related to insulin resistance, which is on the spectrum of diabetes. It is insulin resistance. PCOS is a metabolic condition. Casey can speak a little bit more to it.
Yeah.
It's fundamentally related to the...
What is it? Can you just describe its symptoms and
Absolutely.
its
So PCOS, essentially you have an ovary. That ovary is making hormones. And when that ovary is stimulated by excess insulin, which is the hormone in the blood that helps us take blood sugar out of the blood into the cells, insulin levels go up in the setting of metabolic dysfunction. We basically destroy our cells with our toxic food and lifestyle. The cells can no longer process sugar to energy. So the cell rejects sugar and it stays in the bloodstream. The body compensates by making more insulin to try and drive the sugar into the cell that's putting up a block because it's broken, essentially. That high insulin floats all around the body and does bad things all over the body, like drives cancer growth and also stimulates the ovary to make more testosterone. So you have women who are supposed to be making, estrogen and progesterone in very specific levels throughout the hormone cycle so that we can ovulate. And instead, insulin is driving the ovary to create testosterone, which totally disturbs the balance between all the sex hormones in the female body, and we don't ovulate. So you get these cysts that form because you've got an egg trying to basically ovulate, but instead it can't because the hormones are disrupted because of insulin, which is because of metabolic dysfunction, because of our food. Absolutely.
100%. It's our
And this condition is reversible in as little as 12 weeks with dietary interventions. There is peer-reviewed studies to show this. If we get our blood sugar levels under control and our insulin levels under control, we restore the hormonal balance. And many women, all the symptoms will disappear and they'll be able to become fertile. And yet doctors do not learn. The average doctor is getting zero education in nutrition. And so they don't even see this. They reach the clomiphene, the metformin. The treatment that the OBGYNs are giving to these women is a diabetes drug. And they're not talking about blood sugar. I started a company called Levels, which consumerizes access to a device called a continuous glucose monitor. There are so many women in our community who have PCOS, whose doctors who want to understand their blood sugar so that they can naturally heal their PCOS.
Yes, and have babies.
And these are not devices that they'll only give it to late stage type 2 diabetics, even though we know that PCOS is insulin resistance. And that if we can monitor our blood sugar with this device and get our blood sugar under better control, it can absolutely set us up to sort of naturally heal. But it's not being talked about by the OBGYNs because doctors are not trained to see this.
This is everything, right? This connects everything.
Wow. This is the future of our species, right? This is fertility.
This topic, any woman dealing with infertility, this connects everything because the doctor doesn't know what Casey just described. Look, we've talked to them. They don't know. They did not learn the physiology of why people actually get this condition.